Welcome back, everybody. We're talking with Governor Sununu about some of the questions about COVID-19 here in the state of New Hampshire. The CDC recommending not to have groups of 50 or more out there. Would you implement that as a rule here in the state of New Hampshire?
Well, they came out with that recommendation late last night, so it's something that we've been looking at throughout the day. We don't have a giant issue of that, and most folks have actually canceled most of those events. But in the next 24 hours, we'll definitely be making our recommendations based on the CDC. On
a similar theme down in Massachusetts, they've told restaurants and bars down there you could stay open, but only on a takeout basis. Basically, you can't come in here and dine in. Would you do that here in New Hampshire?
Well, again, that's again another very significant action. It's possible we could get there. There's no doubt, given that if this epidemic really starts to spread throughout our local community. A couple of things people have to realize. We don't have the density infrastructure they have in Boston, where people just have no other means other than in a close contact with large amounts of people. We don't have the widespread community transmission that they have in Massachusetts right now, and the numbers that they have that are increasing quite large. So they have different risk factors down there. We are fortunate right now. We have our 13 cases. We know where all of those cases came from and that they were contacted through international travel for the most part. And so we're going to kind of keep assessing as we go. That would be a very significant step. We're also looking at the data coming out of Massachusetts. How's it working? What are the impacts to workforce? What's the impact to the economy? So in some ways, we're in a fortunate position that we can learn from some of their initial steps down there to make sure that we understand those impacts before we make tough decisions.
We were talking in the break about toilet paper, everybody rushing to get toilet paper. From what you've heard, the supply chain for our grocery stores, for everybody here in the state of New Hampshire, what's it like?
Yeah, so overall the supply chain is good in that I've talked to grocery store chains. I talked to the actual suppliers themselves, the logistics, the guys that drive the trucks. Right now, the toilet paper is being made, food is being made. The stocks will be reshelved. I mean, it's just disappearing off the stock, off those shelves at a very exponential rate. But it's not like those companies are stopping producing those things. The food is definitely coming. There seems to be a pretty high run on flour, bread, toilet paper, sanitizer, of course, but those companies are making that as fast as they can, and we suspect those supplies will be restocked shortly.
But people are nervous out there.
They are.
Now, we expect the number of people getting sick out there to increase here. It seems it's going in that direction. Do we have the supplies to take care of these? But do we have the tests to test these people?
So a couple of different pieces. Let's take the testing first. The testing just in the past few days has grown exponentially as well. So your provider, if they think you are, should be tested, can take a test, can take a swab and send it to a private lab. You'll get results in a couple days. You'll isolate until then, but then we'll be able to have those results. The cases that are in most need, the state, the Public Health Department has been running those tests, and we can get those back much quicker because we actually run those tests in Concord. We've run nearly 400 tests, and again, we have our 13 positive cases so far. When we look at the PPE, right, the gowns, the masks, we hear there could be a shortage of those things. We have a very large supply of PPE coming in, I think as early as today or tomorrow, which is very fortunate. So we'll be able to redistribute that to the hospital so they're prepared, whether it's viral masks or whatever they need on the front lines of this. So in short order, we're going to make sure that we're covered in that respect. We're doing an assessment of all the different beds in the state. If all of a sudden this were to really break out wildly, do we have the beds to take the most critical patients? Please remember, 80% of the people that even get COVID are going to be just fine. They're going to have mild symptoms in their home. It's going to run its course like the flu. So we need to be sure that those that are actually going to the hospital and the providers are the ones that need it the most, and we have the beds and capacity there for them.
Governor, thank you very much. As you mentioned, this is a fluid situation. You can find the latest on WMUR.com and, of course, starting at News 9 at 5.